Are they manipulative? Very, very manipulative. They'll keep on comparing you. They don't spend on you. In fact, they get money from you. They will call their partner's parents more than the partners do. The same partner who is being manipulated, but in public, they will praise them. They do not have empathy. They lack empathy. They don't take criticism. Also, they blame other people when they are in mistakes. So these are very hurting people. That's a part that people do not know.
Do you need somebody? A shoulder you can lean on when you're not strong. We're here for you. All Smile Therapy. Hi guys, and welcome to this YouTube channel once again. This is Mental Fitness with the Camores. Guys, amazing support pale kwa mtandao. I can say that actually many of you really want to be coming for therapy, and we do appreciate it, and we do appreciate that. From our last topic, we had amazing feedback, and you guys, yani mlikuwa mnasema you have learned a lot, so many things that you didn't know, and also myself, I didn't know, and that's why we recommend you guys, you have to start therapy. Before we go, if you haven't subscribed to this channel, please make sure you subscribe, comment, like, share, and go to our previous videos and see which content you missed, and it's probably gonna help you and take you a long way. So ladies and gentlemen, today, of course, we have our amazing therapist with us, and we have an amazing topic that I want us to discuss. Yes, and help me welcome the one and only therapist, Teresa.
Thank you so much, Chechi, and good to see you.
Good to see you too again.
Na upone homa.
Asante. So how have you been?
Have been all right. You, how is everything?
Hata si tuko poa, tunashukuru. Tumesema tukuje therapy leo.
Oh yes.
Yes.
It's important. And you tell them, but they are coming.
Oh.
Yeah, they're coming. Thank you so much for all fans, Pikana Rich and Kemo Camores. Yes, we do appreciate.
Amazing.
Yes.
So last time we had an interesting topic, na watu walifurahia sana. Now leo, today there's a topic that I want us to talk about, because I feel either watu wengi wamekuwa wakiavoid ama wanayongelelea but it's been twisted, or they don't even know the meaning of what they are talking about. Kila hata ukienda, who is a narcissist? I don't know who is a narcissist. Sijui nani ni narcissist, hata like pronounce correctly, sindio?
Yeah.
Sijui nani narcissist. I want us to talk about narcissism today. Yes. So, okay, Teresa, tell us, who is a narcissist, or what is a narcissist?
Wow. So narcissism, this is a disorder, a personality disorder.
Okay.
So personality means there is a human being. And why it's a disorder, it's because the abnormality part of it, that's why it's a personality disorder. So yeah, narcissism is a personality disorder, and one thing that people need to know, personality disorder, first, let me talk about personality.
Yes.
It's just like blood group. You wake up today, you are told you are blood group A positive and all that. That's all about personality. That completely, you have nothing to do about your blood group. However, with awareness, you know, maybe things to avoid, you know who you can donate blood to, who you can't, who you can receive from, you know. Same applies to personality. However, the moment you talk about disorder, it means now there is something that is not functioning well with you. So people, most of the time, and I agree with you, narcissism is something equally have had. First, we label.
Yes.
Anyone who maybe is not going as per our term, or just something we are able to identify, that's a narcissist, you know, wachana na yeye and all that. But clearly it's good to know that it's a personality disorder. And personality disorder, just like we say we have medical illness and physical illness. Yeah, personality disorder, the moment it's diagnosed and confirmed, it's actually a mental illness. So we actually need to know narcissism that we keep on saying, it's like in a physical medical setup. You keep on saying this one is a cancer person, this one has diabetes, this one has this. It's actually a mental health illness when it's diagnosed and confirmed.
Yeah, I was about to ask what confirms that someone is a narcissist?
We do come if you are suspecting, or if maybe it's good we also share the symptoms to look after and all that. But if by any chance you suspect, come. That's what we do. That's our work. We do assessment. For assessment is to test and screen any possible mental disorder or mental illness. So the moment you get to know that you're a narcissist, there is a lot of things that goes around, and of course the next thing is first to confirm it's a diagnosis. Then from there we check the severity. We can have some severity that requires medication. This means we need to have you functioning, and for that stability to be achieved is through medication. But now psychotherapy applies. Yes.
So is someone born a narcissist? Is it a narcissist or a narcissist?
They are all. Narcissist, narcissism, narcissistic, narcissism, yes.
So is someone born a narcissist, or do they grow to be narcissists?
Okay.
Now that you've said it's a mental disorder.
Yes.
Yeah.
It's a mental health disorder. Is someone born a narcissist? The answer is yes and no. Let's look at the causes. First, there is no any clear distinct that this is the cause of narcissism or narcissistic personality disorder. We call it NPD. However, some of the causes, and why I'm saying yes, it can be genetically.
Oh.
Yes. So at time it's genetically transmitted. So that means yes, you can be born a narcissist. So it's very much possible.
What?
Yes.
So does it mean that if you're born with it, we have so many kids who are narcissistic? We don't know.
Okay, let's look at it this way. There is a reason why when you go to hospital, we do something. Hospital, they will ask about the history. When you come to therapy session, we'll do something we call genogram. For genogram, we really want to check on your family history, who you relate with, if death in the family and all that. We'll even go ahead and ask the relationships. Ours is more, remember you said ours is about thoughts, feelings and behavior. So we'll be observing more about your family. So when we say that narcissism can be genetically transmitted or transferred, this doesn't mean that you are actually born with the disorder. The same applies to when we go for our normal hospital checkup and we are asked about the history. At time we are asked about even diabetes in the family. Doesn't mean because there is someone who is diabetic in the family that you have, or because maybe your mom, God forbid, she has diabetes and you are born when she had it, that now you have. But what it means is that you are genetically predisposed. You are more likely to get diabetic than someone who is coming from a family without. So it means the genes are there, they are alive, and should there be trigger, or if not well managed, you are at a risk of now getting the disorder. So that's what it means. So it means some people, they are born genetically predisposed, which means already they are steps ahead to getting the disorder than other people who are not born from maybe parents who suffered the same. However, genetic is one of the things. We also have parenting, so you are still not off the hook. If you are not born with it, you are still not off the hook. I mean, we have people who also suffer diabetes and the rest, and they do not have a family history of the same. So we have parenting can also cause. And by parenting, I mean how you've been parented, how your upbringing. This goes back to childhood traumas. a lot of experiences, what we term as ACE, adverse childhood experiences, that now they link you into that side of disorder. We also have environmental. They are clearly things beyond your own control. Maybe the school you went to, the things that you saw, you went to school without shoes, others they had shoes. And when we talk about parenting, environmental and all, we are mainly, it's to generalize. Because environmental, maybe you went through rejection, abandonment, you know, maybe you are a slim person or you are so light in school and others were calling you light skin or dark skin or just something that you went through. So environmental, you have no control over, or maybe your parent was in such a way. We've seen kids where maybe the parents were taking alcohol and shouting all through. When they go to school, stigma comes through. That is still something else. So environmental is our other interactions. So parenting is home. Environmental is other outside interactions. Society. We also have neurobiological. This again goes deeper into the interaction of your brain's chemical. This can be not caused by anything but just brain chemical. So that's why now we talk about it being a mental health disorder, and it can lead to illness because it's an entire formation. Yes.
Now I've come in and I want to be diagnosed. I want you to tell me if a narcissist or not. What will you look at?
So you come in, and in the process of our evaluation, we'll be able to tell. Just like for hospital, when you go, everything is taken. There is a reason why doctor will prescribe for me to do for you to do a test for malaria and not pneumonia, or for pneumonia not any other, as per the presenting issues. But let me talk about the symptoms. And symptoms, they are out there. So generally the symptoms that I'll be looking at, which I would term as the diagnosis criteria.
Yes.
Gradius.
What is that?
Gradius, gradius, first it need to be there. Now here I have gone the clinical. These are the criteria for me to confirm diagnosis. And by the way, it's good I put this disclaimer, Richie. This is not a counseling session.
Yes.
Neither are we saying this with a particular person in mind.
Yes.
And should you be able to tick the boxes?
Yes.
This doesn't mean that you have narcissistic personality disorder, but what it means is you need to be checked. You can call us, you come, we do evaluation. Why? Because some of these things, they are presented by even several other mental disorders. So you might just be king one, but maybe there is more we need to check on, or more that I'm not going to mention, that qualifies you not for personality, for narcissistic personality disorder, but for other illnesses. This is to avoid self-diagnosis out there.
That's a good disclaimer.
Yeah. So gradius is the need for admiration. Do you know I have the 4th president number? Do you know our 3rd president is our neighbor? Do you know you relate with power? And please note, when we talk about false admiration, I also want to add the word believe. This person believes. They're not just lying. There is a difference between when I want to tell lies and actually when I believe I'm this powerful person. So this person, it comes with false beliefs that they're very powerful.
False.
Yes. It's false because they are not.
Okay.
It's only false because they are not.
They're not.
But do they believe? Yes, they do.
They do.
They believe that they are. So, and also they associate with power. Gradius is anyone who will empower, not just the known power. They can be talking about each and everything. About powerful places, powerful people.
I drive a Lexus.
I drive good car, you know, such. So that comes with exaggeration about self-accomplishments, you know, the things they've been able to do, self-admiration. And also this goes to them thinking and believing that others, they are envious of them.
Before you continue, does it mean, what if they actually have these things, the ones they're talking about? I have the president, that person really has the president's number, they have this Lexus, they're just talking about it.
Then they do not qualify. They are not fitting the criteria. Yes. Okay. So here, there is something we look at, the force. Force and belief, those two things, they need to be there. First, it's force, which means it's something that is not there. Believe, which means you also believe.
Yeah.
No one can tell you otherwise. Yeah, so you know you are not cheating because this is what you believe. Yeah, as much as deep down you know you do not have the number, but you believe you have it. Yes.
Okay.
Yeah.
Now, so what are the characteristics of a narcissist? What is there? Actually, that is where we were.
Yes, yes.
What is there to look for?
So those are the things to look for. And one thing is these people, they are able to identify with themselves so much than you can detect. When someone is graduous, you may not be able, graduous is speaking highly about themselves, who they are, what they did. Like, you don't know, I was always position 1. Okay, here I'm not referring to our parents. They were all position 1 in school.
All of them.
So I'm not referring to them, but comes with that sense of admiration. And we say excessive, excessive need to be admired. Like someone will even take offense, admiring. You've not even noticed they are in. How do you just say hi to me like that? Oh, yes, okay. Yes.
I know someone.
Why are you not noticing that I'm here? They'll just do anything to be noticed. So, and of course, we've talked about them comes with a lot of belief that they're successful, they are powerful, they have it all together. So to them, they are okay. It's what we term as all thinking or nothing. They are okay. Think of anything good, see them. Think of anything happening, who is going to be the next person, visualize them. That's in them. However, now those are some of the things, and they know, the moment, like we said, talking like this, I'm sure there is someone who will be ticking in the boxes. Remember, we've said this is a mental illness or a mental disorder in that case, and so you've found yourself in this. It's not by wish, neither by will. That's something that people forget, and maybe that's why we are busy at labeling other people. But again, let's look in different setup, because these are things in them. How are others able to detect them? In different setup, how do you get to detect? Because all these things we've described, first, they meet the diagnosis criteria. Remember, we said we are just doing this to create awareness. And number 2, it's mainly within them, because the moment I come and I tell you I have president's number, you do not know. But deep down I know. So this might be now for those people, but how are you able to look out and get to know, could this person be going through this? So let's look at it in different setup. So let's start from home setup. And home setup, I mean, if you're married, your wife, your husband, your partner is having the traits, the narcissistic traits. So for now, we're going to refer to them as narcissistic traits until confirmed, until diagnosis has been done to confirm it's a disorder. What are things to look at? You'd expect very powerful, very, 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 no, that's not the thing. They are in reverse at home. They're very exploitative. First, if one partner is working and this partner has more money than this other person, they'll make a way to utilize the entire money. So exploitative really doesn't mean it's about their money, mean even the other person. So you will find, if you're the wife or the husband, you will not even have other friends, because they have a way. And please note, we've said it's a mental disorder, but again, it's also good to note that comes with some form of abuse. And the abuse is, first, they will be in and they will make you, blackmail comes in. They'll tell you all bad things about your friends and anyone around you. Even your brother, they do this. I don't like your sister because when she comes, there will be this. I don't like it when your friend calls you because you'll start behaving like this. And so you also start thinking, by the way, it's about them. So remember, we said everything in excess. They also want you in excess at an expense of other people around you. So one of the things that we get to detect, if you are actually with a narcissistic person, they take you away from your other support system. You find you are in a house, you do not have a friend, because this person has ensured that all your friends, they find fault in your friends, in your family. But do you know why? Because that's the only way to have you, to exploit you, to abuse you without anyone telling you the truth, that this guy, this woman is actually not being kind to you. They have a way to make you even defend them to other people. So it will be in two ways. Either they are taking you away, or you will also isolate yourself. Because anytime you are with them, they'll keep on telling you about your husband, or he's the person who will come and start shouting in the house. So to avoid him come and shout when you have your family members, when you have your relatives, you'd rather not have them in the house. Are you getting? He's someone who verbally, they'll still be exploitative. They can say any word. That's not someone you want near your friends, because he might say something and they'll all be left. Kwani, who are you dating? Who are you with? Who married you? Who is this wife you're having? So what you do is, unknowingly, you sink into the isolation. First, to defend them. And number two, they've also made you withdraw from other people, so that they are able to do everything they want to do, and knowing you can never go and tell your mom, you can never go and tell other people out there. So yes, are they manipulative? Very, very manipulative. Narcissistic people, they are very, very manipulative, and they will manipulate in all the ways. So first, they'll make you feel less of a person. They will make other people be okay. They'll keep on comparing you. If you're the husband in the house, they'll keep on comparing you with other men out there, with other women if you're the wife. And what that does, it makes you start feeling, by the way, I really need to be with this person because he or she is doing me a great favor. Because see other men what they are doing, see other women what they are doing, and me, I'm here. So him being with me is a favor. They manipulate. They manipulate, they withdraw you from other people, they isolate, and this I'm talking to the partner. And you might find that the people, when they even walk in public, you are wondering, is this the husband or the wife to so and so? Because you're even timid. You do not have a voice. That's what they do. What happened on the outer part of it, they're the best of the best. If you want to go and tell someone about your husband, they'll ask you, or about your wife, which one are you talking about? They don't give you, they don't spend on you. In fact, they get money from you. If you have, they'll come with all the projects. It's also good to say NPD people, they are very, well, they are very innovative.
What is NPD?
Narcissistic personality disorder.
Okay.
They're very innovative, so they'll come with all the projects, but their aim is to ensure you have a way of channeling all your money. They'll also make you, you've heard of people who will go and take loans for their partners, and not take, by the taking loan for your partner is not a bad thing. If you're doing this to complement and as a family and together for family growth and development, but if you're taking for them, and you'll keep on paying without even knowing how the money was used. Because anytime you want to question, you'll be asked, is it the first business to go haywire? Is it the first business to collapse? Or what do you want? They will ensure that all your money, they know where they are channeling. Now, let's look at the outer part of it. They're the most giving people, the most loving people. They will call their partners parents more than the partners do. They will do shopping for them. They will do good things. In public, they will praise you. The same partner who is being manipulated, but in public, they will praise them. They will praise them, you know, look at my beautiful looking wife, blah, blah, husband of my dreams. But in the house, it's different. There are these people who you will have hard time to actually, you are like, have seen, especially now the victims, then who can I tell? No one can believe me. This person is so good. We go home, they'll give my parents money, they'll offer promises. That's how they are. That's to ensure you have no backup. Socially, they're the chairman, the mheshimiwa, the, you know, all those things, because definitely the graduates takes them there. So you see, they have double standard, double personality, but it's all equated as narcissistic personality disorder. We also have another setup at workplace. At workplace, they're the people still manipulative. They will ride on achievement of other people. So you get to know, even when you're working with these people, are they taking the credits? Yours is just to perform, and they're the ones saying the much they've done, especially if it's a boss, you know. They will never appreciate other people. One thing I forgot to say is that they're very, they do not have empathy. They lack empathy at all. They'll never fit into your shoes. They don't take criticism and feedback. They don't. They will take defense. They will justify. And actually they are going to take defense on that, or they will take side on that. And also they blame other people when they are in mistakes. So workplace, they want to be, and by then they get promotion because also they are very vocal. They are very vocal, so no one may realize, but doing nothing. You know what we say, good for nothing. Like them, their work is about giving orders. Of course, comes with the power that they are so yearning to get, giving orders and how things should be done, taking credit. You never be promoted because they will always be there to take up the credit.
Now that you're saying that, we have personalities. And we have different personalities.
Yes.
Can't you mistake that with a personality? Can't you mistake narcissism with a personality? Because I'm trying to think, like my personality, mimi mwenyewe, I'm the kind of person who wants things done. I want things done now, here, then. But again, a narcissist has that characteristic where they want things to be done their way.
Yes, and if I was to describe that as a disorder, you want things done here and now, I would actually not term that as a narcissistic personality disorder. It would fit on perfectionism in a personality disorder. Different disorder. That's why we are saying a lot of things. For narcissistic, for narcissists, for them to want things done, this has nothing to do with here and now. Things done their way and them taking credit. That's number one. Number two, things done at an expense of stepping on others, whether they lack 24/7, they're not empathetic, so they're exploitative. That's something I want to get. So someone will be stretched to do more than they're able to. Those are two different people. Two different people. This one want everything done to their advantage, everything done so that they can receive the praise. And by the way, you can do, if they're not receiving the praise, you can go back and repeat whatever you are doing all over again. These are very hurting people. That's a part that people do not know. So I know when I say this, many people will ask, we can never talk about narcissism and you talk about them going through pain. The tendency and the traits of narcissism, it's a defense mechanism from the real thing. These are very hurting people, going through pain, people who actually need to heal to be okay. We've seen, this is one personality disorder that we say it's a barrier to therapy. Why? Remember we talked about in excess and powerful. So this is someone who will even come in a therapy session. They want to become now the therapist. They want to be more knowledgeable. They'll get in touch with Dr. Google. So they'll be coming to maybe try and ask you questions so that you can see, by the way, I do not have, I know, you know. So how does it work is by actually calling it out. Now this comes with the treatment and the help is to call out the tendency. We do know and we are able to go through. Chimepa, you came, you talked about this, you know, the grandiosity part of it, the power, the lack of empathy. Because even in their talk, you'll be able to realize there are people, yes, they have feelings, but feelings for themselves. You will cry, they will just step on you and leave. These are people who lack that empathy. You know, lack of empathy means you actually do not come in touch with another person's emotions. You don't know what they are feeling, neither what they are going through. You're just there. So, but inside they are hurting. They are going through a lot of pain. They actually need to heal. But the but is, all this is unconscious. They do not know. There is help the moment you make them aware that actually this is what you could be going through, and as a result of this you are supposed to be in touch, so that the next time you're giving stories about your powerful anchor, you hold on and say, wait a minute, this is not Teresa, it's the trait in me. And you allow it to sink. So what we tell them, it's okay, patience, coping with patience, that you can be rich, you can be powerful, but it will take time, because they also want everything done at a go. And all these things, they're things to do with power, with admiration, with others, envying them. And they're also envious of other people, but other people of power. If they see, if I'm not the president, then I would like to be as powerful as the president. You get? That also comes with the need to associate. So when you create that awareness, it means narcissistic personality, people with narcissistic personality disorder, they are not aware that actually what they have is a disorder, and that's not their authentic self. So the treatment comes in helping them dissociate, because now they're already dissociated. Dissociated means there is now the authentic me here, and there is now the disorder person here. So I get into the life of this person full of narcissistic personality disorder, and that's why the belief comes in, because I get into this person and actually I believe all the things, knowing very well they are false. I'm not powerful, I do not have the money, I'm not admired, I'm just okay, you know. And at times they think they're the super of the super, you know. So it's to help them now overcome this dissociation by coming in term with their real self. I'll tell you for sure, it's not easy, but it works. They come in term with themselves, and now they get to list all these things, and at time we can transfer those things to goals. You really wanted to be this powerful, can we make it a goal and see how we can work towards that? You wanted to drive this type of a car, can we make it a goal and see how we can work towards that? We also, as part of treatment, we take them through the social initiation skills, and this comes even with family therapy, or also we have groups by the way for NPD, narcissistic personality disorders, where they meet other people. Lack of empathy, you know, lack of empathy means you can be crying and I'm enjoying the fact that you are crying. Tears of pain gives me some happiness. So I'm even happy making you cry, because the more, you know, people who will strive in seeing others suffer, yes, that fits in so well. So this, for them now to learn empathy, it's by now just taking them back and learning about other people. First in groups, they get to know you don't have to go first and go last. Like another person can go first, you can go last, just like that. So for them to learn how to be with other people and how to fit into other people's shoes.
Now, how do narcissists respond to criticism?
First, there is no critics in their lives. That's something that you need to know, because them, it's all thinking or no any other way. Like there is no any other way. By all thinking or no or none means we say all thinking or nothing. There is no any other way. You've ever heard of people saying my way or the highway? That means there is no junctions or branches in between. So there is no critics in their lives. So they react, of course, with anger, with justification, with defense, and they actually take it personally, like a way of personal attack. When you come and you tell, oh, wait, is it okay you tell us about that car when you buy it? You stop telling us about, they take it as a personal attack. They now take it like this person doesn't want to see me, and it goes beyond, this person is jealous of me. So you will never, one thing with narcissists, you will never be right in their eyes. And that's why now therapy helps. You can be wrong and it's still okay. You know, you actually can be wrong, it's still okay. You want to grow, but you can be patient. It comes over time, you know. But most importantly is to get to know where all these things came from. Some of these things, risk factor is something, maybe they had this big business that collapsed. So you see the things that they are hurting them. So them not being able, we say they are the unresolved issues. That's number one. And of course we've talked about the neurobiological, which means now we need even to have intervention, medication, at least for them to be stable, not to have all that graduals. Rich, you can be with someone and they're very graduals. I wish I'm able to put words into it, but I'm not able to, because I really wouldn't want anyone to identify my words with their experience in our therapy setup. But yeah, they come with all those things. And you know, you're just there and observing. Of course, at first, therapy comes with something called UPR, unconditional positive regards. It's not in my place to judge you, and that's why we don't judge, we diagnose. So before I get to ask, am I dealing with grandiosity here, or am I dealing with a powerful person? Because it so happened, I'll have now to take you through the assessment, because grandiose is only on one end. Me, good things, right things. These people, they are holier than thou, they are saint. But you see, when you are dealing with powerful, because still people have power out here. And you know, power is gained via money. You can have money. You don't have to be a politician, by the way, because we associate power with politics. Yeah, you can have money or other things, even just power, because you are okay in your good health, but doesn't go. It's all about you. To them, everything evolves around them. Yeah. So
in life, we say there's advantage and disadvantage to everything.
Yeah.
What are some of the advantages narcissists have, or do they have any advantage?
Wow. Narcissistic people, they form good leaders if they are aware of who they are. They can be, you see, they are first obsessed with power. They are first obsessed with power. So imagine this person being so much obsessed with power, how much they are able to do to actually justify that they are powerful and to retain it. I don't know if you're getting what I'm saying.
I get what you're saying.
They form good leaders. Okay, this is what we say. I do not want to term it as an advantage. I would say it's a misconception. Misconception around narcissistic people. They are good leaders. So what I would say, their authentic self, they're not good leaders, but the good leadership comes from them trying to hide their faults in being good leaders. So what we see, what we face, what we experience is good leadership, but this comes as a defense mechanism, not to know who exactly I am, and so I'm going to be that good leader. They are very good at projects, and not just one project. They can run multiple projects, and very successful one. Remember, we've talked about them being excessive when it comes to admiration, to self-importance, you know, to people of high value. So they'll go out of their way to interact with these people of high value. Don't be surprised someone who once has ever talked about having president's phone number. Yes. Eventually, they might end up getting that number
because they
go out. They're very aggressive. In fact, that's the word. So the misconception around it is that they're very, very aggressive. That's what we see, the face value. Yes. But if I'm to talk to a narcissistic person out there, you know very well you are not aggressive. But you know the things that drives you first is the fear to going back to where you are coming from. Fear of scrutiny and fear to be judged. You know very well you have no option. You are being aggressive because you have no option. Good, you will achieve and all that, but yeah, let's look at your emotional self. Yes.
What are some of the things that suits a narcissist ego? Like probably I have a narcissist next to me. What do they expect from me on this side so that their ego can be soothed? Like
power and admiration. I love your hair, I love your top, love everything about them. Love how they're smiling, be attentive, nod and agree to everything they're saying. With that, you now become the right person.
But I thought everyone wants to be told such good things.
Because we are human, but in excess. That's why I have said love about their everything. From the hair. You know, there is a way you can like my hair, my top, my shoe, and I'm just there wondering where is this heading to?
No, I get,
Yes, but them, and don't just like, give them also a chance to tell you where they bought it from, so that now they can tell you how many millions they spent on it, or how they shipped it, and also ask more. It's about them. Please, I'm not saying that we need to adapt our way to cope with them. We shouldn't. But what they want to hear is everything about them, the entire conversation. How can I be better like you? How can I get this? Show them that they have power. They know they're the plug people. They know where you can get everything. That without you, they are one person. You know, it's an entire basket in them. You want to know where you want. You will take your kids to school. Also allow them to give you more information about that, and you'll hear everything about them. Will associate with power. I can recommend where I take my kids to school, but the money we pay there, now that's their language. Yes, so just self-admiration and they're full of power. But hey, this is what we say. You actually need not to accommodate them, because the moment you accommodate them, accommodating a narcissistic person, you're not helping them. Remember, we said it's a mental health disorder, so they also may not be aware that they have this trait. So you just need to pin it out on them and let them know you actually need to be checked. I feel you've been okay, but I feel you're becoming excessive about this power thing, excessive about what you have, and I feel you actually need to regulate that.
And how do you cope with a narcissist? If you just realize, oh, this person is actually a narcissist, should I continue accommodating them, like feeding them with what they want to hear, and probably it's even hurting me?
Victims of narcissistic people, unfortunately, they don't live to tell the tales. I think that's the best way.
Oh, really?
Yes, I can tell it. Because we've said, as a victim, this is the match they take you through. And they don't stop. Remember, they lack empathy. So they don't stop until you drop. It actually takes someone...
Like drop.
Die 6 feet under.
That's what I'm saying, like drop and drop.
Yes, that's why I have said victims of people with narcissistic personality disorder, they don't live to tell tales if they don't get out of it
as fast as
so
possible.
It takes other people first, and this is why we say be your brother's keeper and your sister's keeper. When you have this friend and all of a sudden they are isolated, they are withdrawn, they are avoidant, just don't say adirinka or now, you know. Check on them. They could be victims of their perpetrator. Narcissist, that qualifies someone to be a perpetrator, you know. They could be victimized. They could be isolated from you. Just call them and get to know, how are you? Is there anything bothering you? And the moment everything around them is defending that person. And in a way, they also start talking highly about the person. Why? Because emotionally, they've first been crushed. They're already into pieces, like fully crushed. And to them, their lives evolves around this person. Remember, they've first been taken through how other women out there, they are better than her, or other men out there, they are better than him. So they already feel it's a favor being with this person. So anything that you tell, so don't check on them, because the mistake we do is we want to tell them about the person they are dating. You want to tell them your husband is actually taking advantage of you, your wife is taking your all money. Please talk to them about them. How are you feeling? And when now they start saying, you know, this person, no, he brings money home, we just want to be like this, get to know. If they are not having independent thoughts, their thoughts evolves around the person. I will ask him, I will ask her when we can come visit. I will, you know, there is something, I will actually go and tell him, we need to come and visit, and then we can plan. So let's be our brother's keeper. We get to know what exactly can be done. And also when our loved one is like getting isolated, they might actually be going through a victim, or they might be victimized by a perpetrator who is a narcissistic person.
Okay, and do we have, as we wind up, do we have people who actually realize I'm a narcissist, so I need help? Do we have them?
We do.
Oh, really?
Oh my goodness.
We do?
Narcissistic people, it's like you and me and him. They're not any different. Don't go out looking for another person. Just look out for signs and symptoms. They are within us, and even as they are talking of, even maybe from this talk, some people will start, you know, detecting some people. So the difference is It's a mental health disorder, which means it's not by will, neither by wish. The moment someone is aware and you get to know, oh, that's the narcissistic in me, you'll be able to control yourself. You'll be more self-aware. You'll actually be knowing when you're about to give, because they also give fake stories to show, you know, how they've achieved. You are like, is it really important? Is it really important, you know? So yes, they're there and they realize. Some they may really not notice. Remember, we said they're already at the stretch. Narcissistic, they are running away from the real issues. They are not authentic self. So when they are left alone, they are hurting people. They are full of pain. They are full of regrets. They even feel they are good for nothing. But what this comes along with them is the imposter syndrome. My good for nothing will manifest as the most powerful, the most, you know, successful person out there. So they know they are going through something. So a time when they are overwhelmed by their authentic self, and when they are tired of, remember here is not faking because it's a disorder. When now they are overwhelmed and tired of who they are consciously, now they are unconscious, want to take over, they'll come looking for help, not because of who they've been, the grandiose and all, but because of the things making them hurt, the pain. And in the process, because we'd also like to know how have you been coping, some will be more aware that no one know I go through this. They never allowed them to see my tears. And now as you're going on, you get to know, okay, this actually is a narcissistic. So you are, for them to heal, they first need to go back to the underlying issues. We just need to heal from the unresolved issues and the pain. Then from there, eventually they are okay, but they get to know. First, people can recover. So yeah, when you're more aware, you live a positive, healthy life all through, and no one will ever detect that you are, but you will always detect another narcissist.
Wow.
Yes.
Amazing. So, very quick, do you have any other disorders like that fall under narcissism?
Yes, we have, that is, you're asking about personality disorders.
Oh, personality.
We have 10 personality disorders. So people know of narcissistic as one.
Yeah, can you real quick tell us the narcissism amongst the 10?
Yes.
Okay.
So now we are left with 9.
We are left with 9.
Yes.
Can you quickly tell us the 9? Then we will go through them one by one.
As we go on.
Yeah, as we go on.
All right. I'll start with these two that are always socially confused. We have schizoid personality disorder.
Schizoid is it schizophrenia? That's a different.
No.
Okay.
Here we do not have schizophrenia.
Ah, okay.
Yes. Now schizophrenic spectrum, that's another different line of disorders.
Okay.
Those are not personality disorders. Yeah. So for schizoid, one thing that schizoid is what we term as antisocial. So please, the right word to be using psychologically is schizoid. You know, I'm a schizoid person.
Oh.
That qualifies what we term as antisocial.
Wait, being antisocial is a disorder?
Yes. And being antisocial is a severe disorder.
A severe disorder.
So the antisocial you are talking about from a layman is schizoid. Like you just want to be alone. You are a lone ranger. You don't like being
amongst people.
Yes, with people. You don't like social events. You are okay. You see, when someone might say I'm an introvert,
yeah, I was coming to that.
Yes, I just love my space, but you're not harming anyone. Please note, you're not harming anyone by loving your space. You are just you're just a lone ranger. Definitely, it's a disorder because human being, we are supposed to socially interact. Of course, we shall be looking at that. But yes, we have schizoid, but schizoid is what has been for the longest or forever has always been taken as the antisocial. So number 2, we have antisocial personality disorder. Antisocial personality disorder, visualize any criminal who will go out there, laugh, joke about killing people. I'm not talking about the crime, because by the way, I'm not justifying any crime here. It's good to come out clean. I'm not justifying any crime, but what I'm saying is antisocial personality disorder. This is a very severe. Definitely, it starts with contact. After 18 years now, become antisocial, and these are people who will kill you, but they don't want to shoot you because you die immediately. They want to first take your nails and see you go through the pain. That gives them joy. This comes with neurobiological. This has a lot of things to do with neuron and brains. They are actually not, in short, they do not qualify to be human beings, and that's why we say it's antisocial personality disorder. What we say is they belong to jail or a mental health facility.
I'm actually thinking with the two already have already drained me. So
Yes.
already we've told them about the two. So meaning we are left with, I think, 6.
We've said 3.
Yeah, we've said 3.
Schizoid and social,
Yeah.
okay, narcissistic,
Yeah.
Schizoid and social. Maybe I can just mention without going
Yeah,
to
you
detail.
can. Yeah, mention.
We have schizotypal. This comes with religion, brainwashing, and all that. That's the 4th one. We have paranoia, paranoid personality disorder, the mistrust. They don't trust anyone. This comes with a lot of mistrust, and others, they are after them. We have histrionic. This comes with excessive admiration and seductive. This is just someone who will ensure they fall somewhere so that you can all like their attention seeker. We have dependent personality disorder. These are the people pleaser. Whatever you say, they're never assertive. They do not have a no in their life. Whatever you say, ni sawa, 22. Yeah. We have, of course, perfectionism. This is still another one we'll be discussing.
It's not the same as OCD.
OCD, obsessive compulsive disorder, is a different disorder, but perfectionism also comes with its share of OCD.
Okay.
Remember, OCD is different from personality disorder, but yes, it's one and the same, but here for perfectionism, it's still the same, by the way. It's the same, but OCD, we have it in 2 different ways. Yeah, so we also have borderline personality disorder. It can get severe. Most victims of suicide, they suffer, have said most, not all, they might be suffering borderline personality disorder. So if it's not well taken care of, yes, it can lead to that. I'm not so sure the one that have I left any? I'm not so sure. Yes.
Yeah. So if we have left, I think we will discuss it on the next lab. So thank you so much for coming.
I'm most welcome.
Yeah, we really do appreciate. And guys, let me tell you, if you feel or you think you need a therapist to probably, or you have someone, by the way, na unakuwaga unamshuku ama wewe mwenyewe unajishuku, am I a narcissist? Is my husband a narcissist? Is my wife a narcissist? Is my child, my mom, my dad a narcissist? I think you are at the right place. You can come here at All Smiles and figure out, do you really have this disorder or not, or the person when you unashuku akona hiyo disorder or not. So,
yeah, sure.
Yeah, and thank you so much guys for joining us. If you feel you really need a therapist, All Smiles Therapy Center is the place to be. Guys, we are fighting so much out here. Sometimes we just want to come and sit and just tuangaliane bas. You know, kuna mtu alikuwa ananiuliza, so sasa you're not going through something, you just go and sit down with the therapist and you just look at each other. Namwambia, yeah, we just go and just look at each other.
That's
like,
still
okay.
therapy.
Yeah, that's still, yeah. So tuangaliane bas. Yeah, so guys, thank you so much for joining us. See you in our next episode of Mental Fitness with the Camoras.
Do you need somebody? A shoulder you can lean on when you're not strong. We're here.